Did you know that gas, bloating, irregularity, and chronic diseases can be challenging to handle, affect quality of your life, and even be debilitating? If you suffer from these, this video is for you. In this video, I will unlock the 3 benefits of probiotics to improving your gut health so that you can start implementing those today. Not only will I reveal those, I will also explain what probiotics are, the best probiotics for improving your gut health, discuss a probiotics food list and how it all ties in with chronic diseases like diabetes and obesity. Hi, I'm Dr. Rivera Cruz. I'm an aesthetics and functional medicine provider in Eustis, Florida. What this channel is about is giving you the tips and strategies on how to slow the aging process and regain your balance in your gut and hormone systems. We all have heard the word probiotics, but what are they? Essentially, they are living microorganisms that confer a benefit to the host. There are multiple brands out there, formulations, and options that you can start implementing in your daily routine after you watch the video. Many people suffer from GI symptoms, chronic diseases, and issues beyond their gut, and these can cause limitations in their social life and even be debilitating. So in this video, I will unlock the 3 benefits of probiotics to improving your gut health. So let's get started. Well, there is increasing evidence that probiotics can help regulate how our bodies react to the foods that we eat and how our organs communicate between each other. And in turn, that can trigger either a good or a bad signal, and that can tip us into health or disease and dysfunction. So let's start with benefit number 1, and that is low inflammation. I might as well say lower inflammation. How does this happen? We have to set the stage first. There's some concepts I have to explain. Let's start with drawing the cell or the gut cell barrier. These are the cells. They are connected between each other. Let's just draw 3. Let's change the color here. And this would be the nucleus of the cell. This is the center, like the brain. And there are some hairy-like projections here, which communicate with the inside of the intestines. Inside and outside. Here on the inside is where you have your foods, nutrients. There's the good bacteria, and there's bad bacteria. And this is a simple way to state it. What happens is that there's always a balance between the good and the bad bacteria. As in any balance, it can tip over, the good and the bad. And what can tip it over? So what happens is there's imbalances on the bad bacteria that grow higher on the inside. And what ends up happening is that it triggers an inflammatory reaction, a low-grade inflammatory reaction. And what ends up happening is that by different messages and mechanisms, that inflammatory reaction in turn with imbalances in the gut microbiota, the lining here of the cell can become separated, and then contents from the inside, meaning the bad bacteria or that imbalance and those toxins that are generated, go out inside the blood circulation. In this case, outside because it's outside of the intestine, but into the blood circulation and your systems, organs, tissues. And at that level,
it can potentiate a greater inflammatory response. With that precedent set and those concepts more clear now, how do we achieve lower inflammation by eating probiotics? So, as I was saying, we have that balance of the good and the bad bacteria. When we eat probiotics, we are tipping that balance towards the good bacteria. And what happens? That increases and the bad bacteria decreases. And that helps improve the entire inflammatory response that had started with the separation of the communication of the cells in between them. There's a lot of other mechanisms on why that happens, and that's a topic for another video that we can discuss furthermore. Continuing on to benefit number 2, we have already established the cell, the communication between the inside and the outside, and the connection between the cells that can get separated and increase the passing of contents from the inside on the outside, more meaning towards the circulation, organ systems, tissue. Okay? With that being established, we can segue to benefit number 2, which would be to lower fat cell storage. Again, there's a mechanism on how this can happen, and let me explain. We have the inside where the organisms are, food, nutrients, and there's multiple communication systems and receptors here in the cells that communicate with the inside onto the organs, tissues. And in this way, meaning the tissues, we are talking about the fat storage cell, which is called adipocyte. In these adipocytes, there is trigger mechanisms in which, through communications between the cells on the lining of the intestines, tell the cell to store more fat or store less fat. And that in turn again happens when you have a good intake of probiotics that can tip our balance for good bacteria to be higher and lower the bad bacteria. And maintaining that balance, we can tell the system what to do. In this case, focusing on less fat storage. And last but not least, we have benefit number 3, and that would be low glucose levels and higher glucose tolerance. Again, we retain our cell diagram and our tissues. In this case would be muscle, liver. That's where the sugar or glucose metabolism happens for the most part. And again, by different mechanisms, in this one it includes GLP-1 receptors and GLP-2 receptors. Those are most commonly known to have been the targets nowadays for the newer medications for lower blood sugars, like semaglutide, for weight loss as well. So those are intertwined in that sense. Lower glucose and lower fat when these receptors get activated, so that helps control and improve the mechanisms for glucose levels. And yet again, we segue to our little tipping of the balance with the good bacteria. By eating probiotics, we are tipping it to send those signals to the cells and then in turn to the tissues through these receptors to lower glucose levels and improve glucose tolerance.
So what are the probiotic sources that we can take? Like now you can go to your fridge, open it. Oh, here I have this XY that I can eat, and that would be a good probiotic. For starters, you can start with supplements. You can buy those in a store. There's multiple options. That's another video. You can have kefir, you can have yogurt, you can have fermented foods like kimchi, kombucha, sauerkraut, pickles, natto, and miso. Probiotic foods like pomegranates, mushrooms, and high fiber foods like vegetables, fruits, nuts, and complex carbs will help maintain a healthy number of the beneficial organisms, as I mentioned before. To summarize, improving your gut organism diversity equates to improving your gut health, which in turn can help improve your overall well-being. The general idea is that taking Lactobacillus species, Bifidobacterium species, Akkermansia species, and Rosburria, among others, or foods that promote them, can positively affect your gut microbiome and in turn help control glucose and fat storage levels. Thank you for watching, and if you have any questions, leave them in the comments below. Be sure to like, subscribe to my channel, and share the video with your friends and family so you don't miss out on more great tips and strategies that will be bringing you. And until next time, bye bye.